On the occasion of Breastfeeding Awareness Month, we have with us expert Dr. Neera Gupta, obstetrician, gynecologist and infertility specialist, Gym Hospital and IVF Center, Bhatinda. Can you tell us why breastfeeding is so important for both mothers and babies?
Thank you for having me here. It's a pleasure to be with all. Yeah, absolutely. Breastfeeding, it provides essential nutrients and antibodies that help protect the babies from various infections and diseases. It promotes healthy growth and development, and it's beneficial for mothers as well. It reduces the risk of certain cancers and helps with the postpartum recovery. And it also fosters a strong emotional bond between the mother and the child. Firstly, the act of breastfeeding releases oxytocin, often referred to as the love hormone, which enhances maternal bonding and feelings of love and attachment. Secondly, the close physical contact and skin-to-skin touch during the breastfeeding promotes a sense of security and comfort for the baby. Thirdly, the eye contact and the interaction between the mother and the baby during the breastfeeding strengthens the emotional connections and communication. Lastly, the regular and the intimate interaction helps in recognizing and responding to the baby's needs more effectively, further deepening the bonds.
What is the ideal duration of breastfeeding? For how many months should a baby be breastfed?
See, according to the WHO Health Organization, it recommends exclusive breastfeeding for at least first 6 months of life. After 6 months, along with the introduction of solid foods, breastfeeding should continue, say up to 2 years or beyond, as it provides essential nutrients and strengthens the immune system. And before they introduce any, weaning products, they even after they introduce the weaning products, they should still continue to breastfeed as long as their, time and, energy permits.
How would you describe the current breastfeeding scenario in India?
See, in India, breastfeeding is a common practice, but there are significant challenges. While a majority of the mothers they initiate breastfeeding, exclusive breastfeeding rates for the first 6 months are lower than recommended. This is due to various factors such as lack of proper knowledge, inadequate support systems, and societal pressure.
What are some of the major challenges that mothers face and how can they be addressed?
The most important challenge is what I feel that many mothers face is insufficient milk supply leading to insufficient feeding. Now this can happen because sometimes a mother's breast milk production doesn't meet an infant's nutritional need. But there is no need to worry. There are several remedies available. Certain over-the-counter supplements can boost the milk production. And additionally, we have Ayurvedic supplements which are known to be effective in increasing the breast milk supply. So it is important for the mothers to consult their healthcare providers to find the best and the safest options for their individual needs.
Doctor, any final message for our listeners?
Yeah, I would encourage all the mothers to seek support and information about breastfeeding. It's one of the best things you can do for your baby's health and your well-being. Now let's work together to create a supportive environment for the breastfeeding in India.
Thank you so much, Doctor, for your time.